Hello everyone, this is Dr. J with the Human Movement Institute, where we have improvement through movement. Today we will be discussing the sternoclavicular joint and injuries of it. We have to remember that this is one of the few joints that has a meniscus. It also has three ligaments, an anterior, a posterior, and a superior ligament that helps hold it in place. Any aggressive chest workout, fall to the side of the shoulder, or a direct blow to it can injure the ligaments and loosen the ligaments and thus affect the ability of the joint to move normally. If we have persistent pain in the front, we can treat it through different ways to help modulate pain, reposition the joint, and help remodel the ligaments. Notice that even Dr. J had a subluxation of his SC joint. And while I always have that little extra bump, I no longer have any pain, no more popping, clicking, catching, and no restriction. What can we do in the short term for SC joint pain and SC joint positioning? We can mobilize this joint by holding down and in or back and out as we extend and flex the shoulder. You will sense some popping or clicking, but the goal is to position the joint in the appropriate alignment as we move the upper extremity. When we move the shoulder, we can readjust or realign or reposition the SC joint. I can also hold on to the clavicular head and use the sternoclavicular ligament mobilization with neck movement. We are using sternocleidomastoid, which has an insertion into the clavicle very close to this joint. This is another way to move and mobilize the ligament to allow healing to occur. If we don't do these movements 4, 6, 8 weeks after, we're not putting the direct force to allow the ligament to heal. With that said, I can also mobilize the superior and anterior ligaments of the SC joint. Doing 10 to 20 clockwise or counterclockwise, side to side, and up and down can help remodel the ligament. This would all be used for healing, pain modulation, and positioning of the clavicle on the manubrium. Lastly, we can look at pectoralis muscle mobilizations. If one pec muscle is tighter than the other, because of its connection to the clavicle, it can continue to pull the head of the clavicle forward. So making sure we know how to mobilize the pectoralis major along the sternum and under the collarbone. Under the collarbone are known as clavicular fibers. Here we can do quick stroking to bring blood to the muscle and to help relax the muscle. Then we can more mobilize the pec aggressively. Cross fiber with fiber. Same thing under the clavicle. I can go across fiber or with fiber. And then combining this with functional movement or multi-angle movements to restore normal range of motion can very well be the treatment to resolve any clavicular pain. If you like this video, please hit the like button, the subscribe button, and please share it with your friends, family, patients, and colleagues. Take care and see you again soon.